Ooh, I was ready. Hmm. What if one of the greatest barriers to economic mobility isn't a lack of ammunition, education, or workforce opportunity, but a lack of consistent health and wellness? Think about it. How can individuals maintain employment when chronic health conditions go untreated? How can students thrive academically when healthcare needs are unmet? How can families build wealth when medical challenges create financial instability? Hmm. The reality is, health impacts opportunity, opportunity impacts economic mobility impacts poverty, and leadership sits at the center of all three. Good morning, and welcome to Disrupting Poverty Through Leadership That Delivers Results AM Talk Show. I'm your host, Dr. Tekemia Dorsey, and today we're discussing one of the most important yet often overlooked intersections in poverty disruption: leadership, healthcare access, poverty, and economic mobility. Today's episode is titled Healthy Communities, Strong Economies: Leadership Solutions for Poverty, Healthcare Access, and Economic Mobility, Agenda 2030 in Action. For too long, healthcare has been viewed separately from economic development. Healthcare leaders focus on health, workforce leaders focus on employment, educators focus on learning, community leaders focus on service. But people's lives don't operate in silos. Everything is connected. This conversation aligns directly with the SDG Sustainable Development Goals of Agenda 2030. Those would be SDG 1, which we know stands for no poverty, SDG 3, good health and well being, SDG 4, quality education, SDG 8, decent work and economic growth, SDG 10, reduce inequalities, SDG 17, partnerships for the goal. Now, Agenda 2030 reminds us that sustainable development goals require integrated solutions, not isolated interventions. Let's begin by understanding why health is an economic issue, as if we couldn't figure that part out. But sometimes the most obvious thing is the most apparent thing we miss directly in front of us. Many people think healthcare is only for treatment, but healthcare is also about productivity. Healthcare is also about workforce participation. Healthcare is also about educational access. Healthcare is also about financial stability and community development. A single parent secured stable employment but struggled with unmanaged health conditions. Missed appointments became missed work days. Missed work days became lost income. Lost income created financial crisis and stress. What began as a healthcare issue became an economic issue like overnight. Because the truth is, health challenges often become economic challenges, and economic challenges often deepen poverty. And these impacts are felt across generations. This is a tough discussion, because a lot of our community today are dealing with and facing economic challenges. And a large portion of individuals that are facing economic challenges, the root cause of their issues are stemming from health challenges. And unfortunately, because of the most recent actions within the federal government within the last 8 to 9 months, it's leaving millions of Americans not being able to afford their monthly premiums, which is going to deepen the impact of households facing economic challenges and possibly lead into poverty. Poverty and healthcare challenges are often reinforce one another. Families face economic hardship, may also experience delayed preventative care, chronic stress, poor health conditions, increased healthcare costs, and even reduced economic opportunities. Ooh, it's early, y'all. Sorry. A student struggled academically because recurring health issues affected attendance. And we often see this as well, even if you're not necessarily in the classroom as an educator daily. And the educational impact eventually affected future workforce opportunities. It's one challenge creates another. And poverty is just not financial. It is often connected to health, education, and opportunity. And I want to break there for a second because, when we're thinking about healthcare and things that impact our youth and young adults and even elderly, we often think of, maybe a cough or catching a cold or running tests. That can also include disabilities. So my youngest two, um, young adults now, but at the time they were 13, actually since the age of 4. So my son has a neurological tic disorder. No, it's not Tourette's or any of that. And later in life at 15, he developed keratoconus eye disease. It's a slow degeneration of the eye that could lead to blindness. My daughter in high school, the spring of her high school year, developed keratoconus eye disease. She was actually the first to get it. And what's unusual about it is that, and no one in my family has it, by the way. Let me pause and stop there. No one that I am familiar with. And so it's very uncommon for a person in a family to receive it. And it's even uncommon for siblings to get it. In addition to the uncommonality of it, not only did they get it in one eye, they got it in both eyes. And then later, my daughter was diagnosed with a learning disability. So the start of my daughter's recognition of her learning disability and keratoconus eye disease popped up at kind of the same time. And it took us, I mean, years to fight for the learning disability to get her help because she was poised and articulate, and she was president of the Randallstown Youth Council, and she was meeting with all of these things that would not trigger a person that had a health issue. And for that, the people at her school denied her um, access to not the 504 when requested by the IEP for 2 years. Frustrated. Luckily, she has, good ethics and supported home. She was able to begin with support to work through it, but not without frustration and side effects to not receiving help. And then and even in the midst of trying to identify, the learning disability, her keratoconus eye disease took off. When I say took off, I mean took off. And if it wasn't for following up as a parent to now, as an educator of 30 years, I'm familiar with how to navigate the educational process. And although I did learn some new things because being emotional and having to fight for her, obviously took my eye off the target. So I needed to get reinforcement. Thanks, Dr. Barbara Desmond. Um, but her keratoconus eye disease, once it was identified as such, the battle started was ongoing. And the battle wasn't necessarily to get her support because medically she was getting it. It was the impact of the keratoconus eye disease on her educational endeavors. And that intertwined with her learning disability that was undiagnosed and BCPS not affiliate, but the person at her school that was head of IEP and 504 didn't want to allow her to get tested, even though her grades dropped. So, and then my son in 2024, and he's a mini genius for those that follow us and know him. He started experiencing the same in 2023, but when we finally got him, went to see the eye doctor in December of 23, by January 2024, he had it in both eyes. So the keratoconus eye disease is something that you cannot play around with. Like as a parent, it is not an option, or even an adult, it is not an option not to get help, not to seek solutions. And luckily, learning through my daughter, I was able to know exactly how to help my son. So, not one youth with one eye, I had two youth with double eyes, and my daughter had was had graduated, you know, from high school, and she got accepted to Spelman and she was on her way there. Then my son, as my daughter was a sophomore at Spelman, turned right around and he was exiting, on his way to Morehouse as a junior, after graduating high school and get his associates in 2024. But the fight was ongoing, and even to this day is ongoing, because had I not intervened, paid attention, knew what my kids were telling me, and taking off and this, that, and the other, they could be blind. They could have low visibility. They could not have done well. They could not be doing well. And so, and also teaching them how to navigate this thing that was very new to me, but very real to them, because they would be living with the keratoconus eye disease for the duration of their lives. And luckily, as a parent, as an advocate, I had to I did step in to help them, but imagine if I didn't, and what it could have done to their educational endeavor. Luckily, my daughter, even in the midst of being diagnosed in ninth grade with an undiagnosed learning disability, but diagnosed with keratoconus eye disease, graduated high school in 3 years, went on to Spelman as a sophomore, because she was also a dual enrolled student, and graduated Spelman in 3 years. Right now, still with the keratoconus eye disease, she received a double cross-linking procedure. She wear specialized contacts in both eyes, and she's on her way to grad school, from poverty to prosperity. And mind you, although she's found success, it was not an easy task. It could have very well led to impoverished conditions, right? And again, I'm focusing on the eye disease, not just the learning disability. My son, who was diagnosed with the neurological tic disorder, we went through his former years, got through that, and then this eye disease popped up. Now, mind you, the neurological tic disorder has not gone away. He has learned to manage it, right? And then with his keratoconus eye disease, he had in 2024 diagnosis with in both eyes, received the 504 to get him through the last semester of high school and college because he graduated high school in 2 years, earned his associate's degree before graduating, and then the next day going to Morehouse, labeled as classified as a junior. That summer, he received double cross-linking procedure. He has now keratoconus. He has scleral lenses, which is a specialized hard contact in his eyes, so that he can see. And at once a year, he goes to see the specialist. Now, he's 18 and will finish Morehouse this coming fall as an 18-year-old. So imagine, yes, I'm throwing in all of the positives to say that things could have gone different fast because of a health condition, not just his neurological, diagnosed neurological tick disorder, but his keratoconus eye disease, right? That came out of nowhere. My daughter, learning disability, undiagnosed, 2 years later, finally diagnosed, but then has keratoconus eye disease. Could have went sideways as a parent if I didn't step in. And even stepping in, them learning to manage, acknowledge, and accept assistance and help for something that doesn't define them, but will for sure impact them for the rest of their lives. And what I love both about my children through support and all those other things that can be negative, they refuse to allow their disability to define them and to set them back or to say what they cannot do versus what they can do. And a lot of our youth and young adults are out there with undiagnosed health issues and disabilities, and even those with diagnosed issues and abilities, disabilities. Parents, adults, caregivers, you have to find a way to help them navigate these waters. One, for the sake of their sanity, two, for the sake of academic, three, for the sake of confidence, and four, for the sake of them learning and having to know how to deal this long and be far beyond you, right? Because if not, then their health conditions can lead to economic instability. And breaking the cycle of poverty requires leadership willing to address root causes. As a parent, I could have threw my hand up. That's your problem. I'm a single mom. I got 4 kids. I'm tired. I'm exhausted. I got to put my life on hold. I'm struggling financially. I'm getting public assistance. Blah, blah. I could have done all of those things over time, but I chose to have them. They're my responsibility, my pride and joy, my legacy. So, as a parent, it is your due diligence to listen, know the signs, seek help, even if you're working 2, 3, 4, 5 jobs like a Jamaican man, Jamaican woman, so that your kids or young adults are getting the help needed so that their health conditions do not lead to economic instability. Yes, it's rough, but you chose to have them. So it is your responsibility. And it's never too late, regardless whether they're 5, 15, or 25. Step in, find out, get them help to navigate these waters so they can improve themselves moving forward, right? And preventative health care must become a leadership priority. If I had not caught, first of all, imagine if I was not dialed into my children, my daughter. Let me start there because she was the straw that broke the camel back, right? But if it wasn't for my son, who's now senior at Morehouse, right, that I just talked about, my daughter's laptop was sitting on the counter. She had just got finished doing a speech for an election she was running for. My son turned the corner in the kitchen and looked at her computer the laptop and identify her grades. Ma, Haley did this, that, and other. And I just turned to her and I was like, what's going on? Right. And because education is a top priority in our household, she did not necessarily at that time want to share what was happening. And I was like, listen, just let me know what's going on. Like, asking her a series of questions, right? Not judgmental, not where she was wrong. And she was just like, mine, she was just like, I'm having problems. And I was like, how long? And as an educator, um, certified school counselor, all of that. So I knew what to ask and I knew what her answers were alluding to. And I was like, okay. So she was letting me know she was having difficulty academically with memory and recall. And right off the back, I knew where this was going. So from there, I wrote the letter the next day to request a review of her academics and to have temporarily a 504 put in place, because not only what was happening at the time of the academic decline, this is at the same time she was having or showing symptoms or communicating she was having problems with her vision. And luckily, we had just gone to the eye doctor. So, as the creative parent and as the advocate that I am, I merged the two together to request it. And the 504 was put into place with no problem because her teachers also backed up the fact that she was struggling a little, right? But on top of her eye concern, that's what pushed it over for her to get an immediate 504 put in place for her to be successful at the end of that year. So, parents, it is a leadership priority within your household and within you as a parent before the world gets involved to put preventative care and educational attainment hand in hand, or workforce or whatever that is an olive branch to the healthcare preventative or intervention issue as a stop. Like, what? Hold up, we got to stop here. We got to do what we need to do because there is a gap, right? And that's important for you to do, because if you don't, then these healthcare issues continue on and it becomes a long-term downfall. And many communities focus heavily on crisis intervention, but it doesn't have to be a crisis for anyone to intervene in, right? Right. But sustainable systems focus on prevention. Prevention includes routine health screenings, annual eye exams, annual dental cleanings or dental appointments, annual physicals with your doctor. Don't miss them, right? Wellness education. Let me tell you, as a parent, I've been educated since 2022, 2020, right? Because that's when I think I got the dates wrong early. That's when my daughter ended up being diagnosed in 2020. I didn't say 2022. Yeah, in 2020, right? Mental health awareness. When Chesapeake High School in Baltimore County, by way of their IEP chair, refused to allow my daughter to be tested, and her 504 initially during her sophomore year was not being implemented, my daughter started showing symptoms of a mental health breakdown. And it was not pretty. And all I could think was, what the hell is going on, y'all? And as soon as she got tested, it was diagnosed, and she started getting help, the episode and the symptoms went away. That's when I realized that she was internally struggling, and that was her way of sharing what was happening with her, right? Because I thank God that she didn't have a mental health breakdown, but her trying to work day in and day out, sun up and sundown, and in between to ensure that her grades didn't fall, not being heard and not receiving, to her satisfaction, help was driving her up the wall. So, health conditions really could lead to mental health symptoms that could, if not intervene. And mind you, we were dealing with preventative maintenance and preventative everything, but people on the other side weren't listening, which often happens in education, right? So, mental health awareness, community outreach, and most importantly, family engagement. And that is so important because imagine if I, as a parent, again, allowed things to just fall by the wayside. I could have lost, it could have been a lot more not positive, right? So, recently a community health initiative focused on preventative care and wellness education. So important. And over time, that community healthcare outcomes improve. There's the school attendance improve and workforce participation increase. And this is true. Personally, I can tell you all these things are absolutely true. When you put preventative care and wellness education on top of family engagement, incorporating, agencies and providers that can help, all of these things improve because the investment in prevention produce broader benefits for the individuals and the communities, right? And preventative care is not just a healthcare strategy, y'all. It's not. It's an economic mobility strategy. And remember, economic mobility starts with individuals and roll out into the community. So if the individual feels empowered and is fluid, then the community benefits, and vice versa and backwards, right? And leadership must move beyond healthcare systems alone. Agenda 2030 emphasizes partnerships because health outcomes are influenced by multiple systems. Education, healthcare intersects with education, housing, workforce development, transportation, and community services. A coalition of healthcare providers, educators, employers, and community organizations work together to address barriers affecting local families, which is needed, which is wanted, which is always wanted. But instead of treating the systems independently, they coordinated solutions. The results: better outcomes, greater efficiency, stronger community impact, and sustainable solutions that required collaborative leadership. Everyone gets credit, everyone has input, everyone is successful. And economic mobility must include wellness, right? Because too often, economic mobility is only measured by outcome. But true mobility, everyone, includes physical health, it includes mental wellness, it includes financial stability, educational advancement, family well being. You know, I had a discussion with an individual over the weekend. Went to a birthday party to celebrate um, my adopted nephew 21st birthday, and happened to speak with a young lady there, older than me, could be my mom, but she's still young. And she was telling me about two individuals who earned similar salaries. One had stable health, strong support systems, and access to wellness resources. The other, unfortunately, faced ongoing health challenges, not uncommon, especially in today's world, and their economic outcomes different significantly. Economic mobility is more than about employment, right? It is the ability to sustain progress. And for one of the individuals she was sharing with me, that was stability or progress was no problem. But for the other, the progress was not so stable. And this brings us directly to Agenda 2030. Agenda 2030 recognizes that healthy people strengthen communities. Strong communities create opportunity. Opportunities reduce poverty. And leadership drives systems change. From personal experience, this is all so true. The Sustainable Development Goals challenge leaders to move beyond isolated thinking and to embrace holistic solutions. Because the Sustainable Development Goals in silo are a thesis by itself. But when paired together, it becomes a dissertation to success. Communities thrive when health, education, workforce development, and economic opportunity work together. So let's bring this into action. Here is your leadership challenge. Examine one health related issue affecting economic mobility in your community. All you got to do is open your eyes, look out the door, north, south, east, and west, and you'll find it. Build one partnership connecting healthcare and economic opportunity. Advocate for preventative care initiatives to strengthen families. I cannot emphasize this more than enough. My kids are doing better today. Mind, body, soul, spirit, and confidence and leadership. Because as a parent, I emphasize preventative care. And my family and their lives are stronger as a result. And support solutions that address wellness and economic stability. Because here's the truth. You cannot build prosperous communities without healthy people. And you cannot disrupt poverty without addressing the healthcare challenges that often stand in the way of economic mobility. You cannot. The leaders who will shape the future are the leaders who understand that health and prosperity are not separate conversations. They are the same conversation. Well, if this episode challenged your perspective, follow Disrupting Poverty Through Leadership That Delivers Results AM Talk Show. Share one healthcare issue impacting economic mobility in your community. Tag a healthcare professional, educator, policymaker, employer, or community leader working to improve outcomes for families. Because Agenda 2030 is not simply about reducing poverty. It's about creating healthier, stronger, more resilient communities where every individual has the opportunity to thrive. I so enjoyed this episode. I hope you did too. Hit the subscribe button, download, listen later, watch later, share in your network. Let us know how you're doing with these leadership challenges, growing as a leader, or most importantly, becoming educated about Agenda 2030 awareness, impact from the international level down to the local level. So until the next time, I look forward to seeing you on the other side, and be sure to listen to the episodes with my guests that are rolling out each week. And until then, have a great day, have a great time, and peace out.